Good afternoon. Thank you all for joining us for another update on the cyber attack affecting our healthcare system in Newfoundland and Labrador. As a government, we continue to avail of expertise in the areas of IT, privacy, cybersecurity, and law enforcement, as we all work to get our systems back up and running. Please know that the information and language we use is deliberate and intentional. As previously said, based on investigations to date, we currently understand that certain data was accessed. The investigation is also focusing on the impact of that access to determine what, if any, data was taken. Access is different than exfiltration. To reiterate, we have no evidence at this time that the information accessed has been misused. I am joined virtually today by the Honourable John Haggie, Minister of Health and Community Services, along with Andrée Robichaud, President and Chief Executive Officer of Central Regional Health Authority. I will now turn things over to Minister Haggie for some remarks.
Thank you very much, Mr. Hogan. Good afternoon, everybody. Yesterday, we were able to confirm that as a result of the cyber attack on the 30th, some personal information and some personal health information had been accessed from within our systems. At that time, we were aware that some information about current and former employees and patients in Eastern Health for the last 14 years and Labrador Grenfell for the last 9 had been accessed inappropriately. At that point, we said that the investigations were ongoing into Central Health. We then, since then, learned from Central Health that some of their data has also been accessed around patient personal health information. While not confirmed with absolute certainty, we also have reason to believe that personal information of employees and former employees may also have been accessed. Ms. Robichaud will provide more detail shortly on that. As was mentioned yesterday, Premier stated that an attack on one of us is an attack on all of us, and I think it's important that we appreciate that our colleagues, our neighbours need support, and we must present a united face towards these threats. There's no indication that any of this information has actually been misused, and obviously we'll continue to monitor that. There's also no indication that any banking information has been accessed. But regardless of that, we're encouraging everybody, patients, staff, and vendors of the Regional Health Authority to remain vigilant as always about their own personal or business information. We put on the bottom of the Health and Community Services page yesterday a button with as much information as we have around this situation and what mitigation is offered. And for those people whose questions are not answered there, we have a toll-free line as a backup, and that is 1-833-718-3021. I also want to reference support from mental health services. This is a stressful time with COVID, and now this on top of it. And so anybody who feels in need of support of that kind as a result of these data breaches has access to a full suite of online e-mental health services available at Bridge the Gap at 2ps.ca. Doorways, our local clinics, is available for walk-in sessions without an appointment in at least 60 locations province-wide. For those who are more challenged, the Provincial Mental Health Crisis Line and the Channel Warm Line are both available 7 days a week. There's also a federal program called MindWell, and MindWell U for residents in this province is available free for anybody who wishes to use it. With that, I think it'd be best now if I pass things over to Ms. Andrée Robichaud, President and CEO of Central Health. Andrée?
Thank you, Minister. Good afternoon, everyone. On behalf of the Board of Trustees and myself, I want to start by saying that we deeply regret that this incident occurred, as stated by the previous speakers. We're taking the steps to protect the privacy of our employees and patients and members of our community. As indicated, we can confirm that some personal health information has been breached from about the last 13 years. Information used as registration, as indicated yesterday: name, address, MCP number, physician name, phone number, and other basic information. Also, as indicated, in the spirit of transparency, we believe that our employee data has been breached, and I put the emphasis on believe. This hasn't been confirmed. Therefore, our employees are now able to take advantage of the mitigation strategies that have been put in place. The minister has gone through some of them. The provincial call center. There will be credit monitoring made available for patients and employees, and the mental health supports that the minister has just gone through. I think it's important to note that we have no evidence that our banking information and vendor information was involved. And also, at the risk of being redundant, there's also no evidence of this information being misused or disclosed at this time. Please note that individuals have a right to contact the OIPC or the Privacy Commissioner, and a notice will be posted to the Central Health website containing the address of OIPC. Again, on behalf of the board trustee and myself, I want to reiterate that we deeply regret that this incident occurred, and as stated by the previous speakers. Thank you very much.
Before we take questions from the media, I would again like to remind the public at this time we have no evidence to suggest that the information accessed has been misused, and we continue to update the public over the last couple of days as a precautionary measure and to ensure we are being as open and transparent as possible, and that includes the regional health authorities. I encourage you all to do what you can to protect your personal information. This includes contacting Equifax or TransUnion to get a copy of your credit report, monitor banking and financial information for any unusual activity, report any irregularities in your mail delivery to Canada Post, such as open envelopes or missing documents, use strong, complicated passwords, ensure antivirus software is up to date, do not open email attachments that look suspicious. If you suspect your social insurance number is being used fraudulently, Service Canada advises to file a complaint with the police. Contact the Canadian Anti-Fraud Centre at 1-888-495-8501. Discuss with Equifax or TransUnion about whether you should put a fraud alert in place on your credit card. And you can report suspected fraud or identity theft with the Canada Revenue Agency by calling them at 1-800-959-8281. With that, we are now ready to take questions from the media.
Thank you, Minister. We have 8 media registered for today's availability. The first round of the question and answer session will give each reporter the opportunity to ask one question and one follow-up. Following this will be a final round where each reporter will have the opportunity to ask one final question. Our first questions are from Peter Cowan with CBC. Please go ahead.
I want to ask about the language that you've used. Minister Hogan, for example, at the beginning said that there's evidence the information has been accessed, but not that it has been obtained. Considering this is digital information, and once you access something, it's obviously easy to make a copy. It's a whole lot different than accessing a physical record. Do you have evidence that they were not able to make a copy of this?
So thanks for the question, Peter. And the ease or difficulty of copying is not something I said at all. I said that we have evidence that the data was accessed. And what I've been saying to people who have asked me this question is sort of to think about it in terms of maybe your own workplace. And for example, in my department, the Department of Justice and Public Safety, I have access to all kinds of information. It certainly doesn't mean that I've taken it, and it certainly doesn't mean that I've stolen it. So that is the reason for the distinction. In the cyber world specifically, access to that data, this bad actor has access and had access to data at some point in time, does not mean that it was copied, does not mean that it was taken. The ongoing investigation will lead us to a conclusion about whether that has happened, but at this time we have no evidence that any of the access data has been misused.
And I want to ask about one of the supports that has been promised is credit monitoring for people who may be subject to this. Do we have any details yet on what exactly is going to be covered, especially since, for example, you mentioned a fraud alert through the credit monitoring agencies? They charge a fee for that. Is that going to be covered by the province?
I'm looking to Ms. Robichaud or Minister Haggie. Yep.
Sorry, yeah, I'll take that. From my understanding, the department has been in discussions about just that subject, and as yet, it is not clear exactly what the demand would be for it and what level of cover would be required. That may become apparent with time as the investigation unfolds, but currently the offer is there, and we will scale up the resources required depending on the demand and the nature of our subsequent investigation. So it's early days yet, Peter.
Our next questions are from Brian Callahan with VOCM. Please go ahead.
Thank you. Could you, Minister, provide a little more clarity around the whole encryption issue? Do we have it right that it wasn't on these systems that were hacked, and did that make it easier for them to be hacked?
Sorry, I'm on mute here. We're into the realm of IT and security, and we really have to be careful what we say, Brian, and I know that's not a terribly satisfactory answer, but this is an area in which this conversation here is more than likely being relayed to the people who had a hand in this attack. What we say now and what we let slip now could actually lead them to make the situation worse or to slow our attempts at remediation, or both. So discussions around encryption or not, where the data was, who had it, these kind of things, I won't be talking about in public. At some point down the line, this will all be made public and apparent. But at the moment, our advice from world-class experts is to say nothing.
Okay, and going back to Peter's question, I just want, the copying and the possible extraction versus access. Do we know how long they had access, or is the attack even over? Like, do they still have access?
My understanding around when the attack occurred and how long it took place over is that this is still part of the forensic investigation. Equally, I understand that as soon as we were aware of this, steps were taken to secure and safeguard the data that we do have. Beyond that, again, we're kind of going down a road. So my understanding is that steps have been taken to avoid any further issues with data.
Thank you.
Our next questions are from Mike Connors with NTV. Please go ahead.
Hi, the Privacy Commissioner said he's launching an investigation and has been talking about thousands or tens of thousands of people being affected. Is that a fair number, or do you have a sense yet of how many people have actually been affected by this?
The period involved is lengthy. We don't have detailed numbers, but if you look at the average interactions between the public and the healthcare system, and bear in mind that 3 out of the 4 regional health authorities have been affected, our figures show that by and large there are about 400,000 interactions between the public and the healthcare system per year. So the math could be quite large, but we have no way at the moment quantifying it beyond that.
Thanks. And Mike, I do just want to add that we welcome, and I'm sure the regional health authorities welcome, the investigation by the Privacy Commissioner. Certainly that's one of his roles, is to conduct an investigation, and there's no more serious matter than this that I'm sure he's faced in his time as Privacy Commissioner. So that obviously that investigation is important, and once this is all over with, we look forward to the results of that.
And Minister Hogan, I believe you said this bad actor had access at some point in time. So does that mean that, are you sure that they no longer have access?
So I believe Minister Haggie just provided an answer to that question, but that was the reason yesterday for advising the public that access had occurred.
Our next questions are from Sarah Smelly with the Canadian Press. Please go ahead.
Has information learned so far, like indicators of compromise, been shared with other provinces and health authorities so that they can protect themselves?
Certainly, my department are actively communicating with national agencies as well as, federal government. Intergovernmental affairs is not my portfolio, Robichaud, but my understanding is certainly that the Premier and the Prime Minister have spoken on this regularly. I know Jean-Yves Duclos the other day was really keen on, at some point, and he said at some point when it's appropriate to do so, they would really like to learn from our experiences. I think at the moment our experiences are still not totally clear and characterized, and once that happens, I think there'll be a lot of learning for everybody.
Okay. And what can you tell us about your efforts to monitor for any misuse of this information? Like, have you engaged parties to monitor the deep web or the dark web, for example, for any publishing of this information?
We have engaged world-class expertise. What they do is their thing, and we've just crossed the line into cybersecurity, because if I were to tell you what I understand they're doing, then they would do something different, and we wouldn't know about it.
Thank you.
Our next questions are from Evan Corrine with The Telegram. Please go ahead.
Yeah, hi. Yesterday it was mentioned that the province and regional health authorities have some level of cyber attack insurance. Would that only cover directly the province, or would it also cover like potential losses to citizens from their data being breached?
Sorry, I'm on mute. There is insurance for the regional health authorities. Ms. Robichaud would be able to give you what details we can. Obviously, the nature of that, in actual fact, and revealing that in public might actually potentially jeopardize our situation in the near and immediate future. So not really comfortable going down that road. Suffice it to say, we have a level of protection. Time will tell whether that level of protection meets the threat. Either way, we as government and the RHAs together will deal with it.
Okay, thank you. So the other question I would have, I guess, would be, what would you say to people, like, I know there's a lot of talk about credit monitoring, and people need to be more cognizant and aware of their data. What would you say to like seniors and stuff like that who might be a little less computer literate and not as up on these kind of tactics?
So I can take that question, and we understand that, I mean, this is an issue that occurs not with just with regard to credit monitoring situations. So there are 1-800 numbers that we've provided as well. Again, the Canadian Anti-Fraud Centre, 1-888-495-8501. Canada Revenue Agency can deal with certain situations as well, 1-800-959-8281. I also believe, I don't have, there will be a provincial call center number that will be established and maybe up and running now. It's 1-833-718-3021. So that's information for people that we've thought about that may not have access to internet and be able to do certain things.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Bonjour, j'ai d'abord une question en français pour Mme Robichaud. Avez-vous une idée de combien de travailleurs et de patients sont touchés dans la régie de santé du centre? Et quel est votre message aux travailleurs et aux patients dans le centre de l'île?
Merci beaucoup. Comme a indiqué le ministre, on a 13 ans d'informations et le nombre de visites qu'on peut avoir est un nombre assez gros. Ça fait que ça n'a pas été établi à ce moment-ci, le nombre de personnes. On est en cours d'une investigation, donc avec un peu de temps, on pourra quantifier le nombre. Et pour ce qui est de nos patients, on les encourage de prendre connaissance des différentes stratégies qu'on a mis en place, soit le centre d'appel qui peut leur donner du support. Aussi, on a des supports de santé mentale et les gens, à travers du centre d'appel, pourront les diriger pour avoir de la meilleure information pour voir au support qu'ils ont besoin.
Merci. I have a question for, I guess this is probably for Minister Haggie. In our technical briefing yesterday, we received a package of documents. I'll read you a line. It says, we understand that some personal information and some personal health information was obtained from our system. How do we reconcile that with the message that we're getting today, that information was just accessed?
I think that may be a difference in usage of words. We have, certainly Minister Hogan and I have discussed really tightening our use of words to reflect more accurately what we understand the situation to be. Accessed and obtained are different verbs. They're different words and mean different things. Our understanding as of today is that information was accessed, whether it was further altered or taken away or copied. That is not clear. What we can say at the moment is from our experts involved in the field, we have no evidence of it being misused.
Our next questions are from Daryl Roberts with CBC. Please go ahead.
Hi there. We've heard from the Information and Privacy Commissioner that the breach was first suspected on the Monday after the attack. I'm wondering why wait until yesterday to confirm that people's information had been accessed.
I think the key there is confirmation and an evolving solution. I think awareness of the possibilities of what had happened is completely different and probably comes a lot earlier than being able to actually confirm it. Our responsibility is a balance between speculation and being open and transparent. And what we can see very clearly is that speculation in this situation, because of security, is actually pretty dangerous. What we have said, and what Ms. Robichaud emphasized, was that certainly in Central Health, for example, they are aware that patient health information has been accessed, and they have reached a confidence level that it is likely that that may also have happened to employees. Again, it's a balance about transparency and speculation, and I think on balance of what I understand we have, that is a reasonable statement. It could well be that in the next day or so, someone comes along and says, no, we were wrong. However, the feeling from the experts is that the evidence is strongly pointing in that direction, and we were here, and out of an abundance of caution, we presented it the way we have.
We heard this morning that the Information and Privacy Commissioner will be launching a formal investigation into this. I'm wondering how, in your view, will that connect with the government's investigation into the cyber attack?
From my point of view, I welcome it. I think the more we can learn from this, the better. The Privacy Commissioner has a slightly different view and a different mandate than the department, than the Regional Health Authority, and than Bell, for example, who would be looking at their part in this with their infrastructure, just as the Centre for Health Information would. And I think the more views we get on this, the better.
Our next questions are from Renelle Legros with All Newfoundland Labrador. Please go ahead.
The Premier and the Health Minister, I assume, both were employed by regional health authorities during the period in question. I'm wondering if we can assume, or if you can confirm, that the Premier's and I guess the Health Minister's employee or personal information has been compromised as well.
I'll just quickly jump in, and Minister Haggie can speak for himself. And the Premier is not here today, but obviously that's a personal question. But the Premier, I think he would say he's no different than anybody else in the province right now. That includes Minister Haggie. That includes any members of government, cabinet, etc.
From my perspective.
Sorry, Mr. Haggie. The purpose of these briefings in the last 2 days is to advise everybody to take precautions, and that includes the Premier. I would advise the Premier the same way I've advised everybody here today and yesterday to get his credit report checked. But as for his specific answer on that, obviously he can speak for himself. But it's a private matter, and privacy is important, and transparency is important. So that's the purpose of the briefings over the last 2 days.
From my point of view, I really could only echo what Minister Hogan said. I mean, I'm a citizen of Central Health. I may or may not have used it as a patient. I wasn't actually employed as a surgeon there. I was actually a fee-for-service position. But I did actually receive money for administrative roles I held. So, yeah, I'm in that boat too.
And Minister, maybe just on a personal level, how does that make you feel? You're involved with this as well. Have you made any credit checks? Have you taken any proactive steps like applying for credit protection as you're walking through this?
I've tried to practice cybersecurity. I came across it in another life, and certainly with government, we have our own internal processes. But no, I use a password manager, and I would recommend that to everybody. And periodically, I change the passwords on site that I visit frequently. In terms of what I do, is I use phone-based apps to monitor my bank account, and have done for some years. Because that's kind of the way I'm wired. So wait and see.
I will now go back to each reporter to see if you have one final question. Peter Cowan with CBC, do you have a final question?
I do. We know that a lot more systems than the ones that we've talked about were part of this attack. Is the investigation continuing? Is it possible that there may be more personal information that was accessed? Or are you fairly confident that these are the areas that were exposed?
I think at the moment, from a health perspective, we keep an open mind. We certainly have an integrated system whereby health information for the population and employee information is shared across a network, and that was the subject of the attack. Whether there are other areas yet, the investigation is still ongoing, and as each module is reconnected or as each area is looked at, these areas are screened, plugged in, as it were, in a test environment and monitored, and only when everyone's 100% happy are they fired back up and plugged in for functionality for the system as it stands. But time will tell. We're still in a dynamic situation. And you've heard today something different than you heard yesterday. You heard something yesterday that you hadn't heard on Monday. So the only constant in this is change.
Brian Callahan with BOCN, do you have a final question?
Sure, yeah. So we know then that the information was accessed, but we don't know if it's been misused or will be misused. I guess we're just basically waiting then to hear whether or not someone feels they've been breached or their banks or personal information. Is that the only way, or will you be notified, say, by cybersecurity? I guess one or the other.
Yeah, I think that's pretty accurate. We can't let anybody know until something has happened and until we know that it's happened. So we've told everybody over the last 2 days what we know. We're telling people that investigations are ongoing with regards to what you said, what if anything, has been done with the access to the data. And as soon as we committed yesterday, and we're here again today, we'll continue to provide more information as soon as it becomes available.
Thank you.
Mike Connors with NTV, do you have a final question?
Lawyer Bob Buckingham has spoken publicly about starting the process for a class action lawsuit. There have been concerns raised that the government has been kind of maybe minimizing the severity of this cyber attack over the past week. Is part of your reticence to communicate things also tied to that this may all end up in court eventually?
Certainly not from my perspective. We were here yesterday. We're here again today. We'll be here tomorrow and any day in the future that we have to be as soon as we have information to share with the public. It's nothing to do with Mr. Buckingham. If and when he starts a class action lawsuit, it certainly will go through the court process. It won't be the first time we deal with the court matter. It won't be the last.
Sarah Smelly with the Canadian Press, do you have a final question?
I do, thank you. I just want to, update this. Are you prepared yet to say what kind of an attack this is and whether a ransom has been demanded?
So this is an ongoing investigation, and as Minister Haggie said a few times this afternoon, it's not prudent for us to comment on certain things to jeopardize the investigation and to jeopardize anything further that may happen. So we won't comment on anything specific related to that question.
Thank you.
Evan Kareem with the Telegram, do you have a final question?
Yes. Information that was provided to the media yesterday said the Eastern Health and Labrador Grenfell Health information was accessed from the Meditech data repository. Is that the same system that is believed to have been accessed to Central Health?
Yes, it is.
Thanks, Andrée.
Patrick Butler with Radio Canada, do you have a final question?
I I do. I'm just trying to understand if personal information is indeed stolen, what is the obligation of government toward patients or workers who have been affected, given that this information would have been stored on government computers, government servers?
From our point of view, our obligation under the law is to protect it as best we can. In actual fact, that's the regional health authority's role as custodians of this data, and the Personal Health Information Act and ATIPA and various other things has ring fences around that. From the point of view of government, it's certainly to protect the citizens of the province, and in situations like this, to do our level best to contain, prevent it happening again, and work to make our systems more secure, whilst also supporting those people who have had challenges, and certainly anybody who can show that they have credit issues as a result of this, will obviously, we have a monitoring offer out there, and that will not cost them any money if that's what they need.
Is there any financial obligation, though?
I wouldn't like to speak to that precisely, as the financial piece at the moment, from my point of view, is very much a secondary consideration. It's kind of a summing up once we've done all the other things I referenced.
Thank you.
Daryl Roberts with CBC. Do you have a final question?
I do. Yesterday, you said that the information in the Western Health region was not breached. Can you tell us a bit more about why you're so confident that the information in that region wasn't breached?
No, I can't, because that really walks into the cybersecurity. What is it that identifies what was attacked successfully, what was maybe not? I don't think it would be wise to go down there.
Renelle LeGros with All Newfoundland Labrador. Do you have a final question?
Yes, I'm just looking for an update, I guess, on the IT outage as a whole. Where are we today with bringing everything back online?
Certainly from the point of view of functionality, there is a lot going on behind the scenes. You've seen the COVID forms, for example, come back online. There will be considerable work is going on in the lab, for example. One of our desires is to get lab and DI back up and running. It's a lot bigger job than one might think. There is some limited functionality that's been restored within facilities. So, for example, if you have a blood test through the emergency department, it doesn't have to be carried by hand or phoned to the emergency department from the lab. In certain facilities, that can happen on a printer, but it's not necessarily a total electronic connection. So it's stepwise. Certainly, I think pretty well every machine in the system will be examined by the time this process is done, and there's a lot to go through. I think from the point of view of the public, they're less interested in what systems are up and running as what services are available. And the RHAs have done an excellent job, I think, of providing regular public service announcements. And you'll see each day they've differed slightly and things have come back. And I would refer members of the public to their own RHA to find out exactly what is there that might affect them. And be assured that, we are working 24 hours a day in shifts and relays with maximum effort to get this sorted out as fast as we can.
Thank you, everyone. Minister Hogan, do you have any final comments for today?
I do, and just to conclude, we do want to thank patients and employees of our regional health authorities for their continued patience and understanding. As we have committed yesterday and again today, we will continue to provide more information as it becomes available. Thank you.
Thank you, Minister. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.